I'd like to call the meeting to order. Be the Services Committee meeting for the month of May. And do I have a motion to approve motion to approve the agenda? We got one by Tony and seconded by Dan Fay, because I think Linda just raised her hand. Who seconds it? Okay, Nicole Terminelli seconds it. Go. All right then. All in favor of the calling the meeting to order and approving the agenda?
Aye.
Aye.
Anyone opposed? Carried. Approve the minutes. Do we have a motion for minutes? Approve the minutes. Okay, go ahead. Rick Perkins, and seconded by Mr. Forsyth. Any discussion? All in favor?
Aye.
Opposed? Carried. Now we have an update on the COVID.
We do. Dana is joining us. Dr. Williams may not be able to join us, but I think Dana should be there. Is she, Dylan?
Yes, I think so.
There she is. Hi, Dana.
Hi.
Go ahead.
So I just want to give you an update with the case status. So of today, we have 100. We had 2 new cases for this date and 2 new cases yesterday. Since our last meeting, we've had 8 new cases. That's an average of about 1 cases. So with regards to all of the cases,
I don't know if they can.
We're having a little issue hearing you. Can you speak a little closer to the mic, maybe?
yeah, there's actually a lot of noise from your room, actually. I'm not sure, but yeah.
Okay. You're coming in good now.
Okay.
Go ahead, Dana.
So as I was saying, since last week, we've had 8 or 9 new cases since we spoke last week. So the daily average for the last week is about 1.3 cases. So we do continue to go down in the number of the cases. Can you hear me okay?
Yes, we're doing good now.
Okay. We have taken 152 cases out of isolation. And so we have people doing well. There are currently 4 people in the hospital. For the initiatives that we have for the department, the state contacted us last week to do the testing at all of the nursing homes and then 2 of the adult homes here in the county. So there are 5 nursing homes and 2 adult homes. We have been talking with them, and late last week, we got the supplies to do the testing of just the residents so far. And so we will be doing the testing, or we will be providing the testing kits to 2 of the nursing homes just in the Messina area. And they will be testing just the residents there. And then there is an adult home in the Braziers, or in the Brazier Fall area, that they're going to do all of their kind of residents there. We just received last evening more of the testing supplies where we can start to do staff of all of these locations. With the executive order that was given out last night, 202.30, nursing home staff are now supposed to be tested twice during a week. So we have set up a conference call. It's myself and Dr. Williams with all of the nursing homes to discuss how this is going to happen. We're not sure where all of the testing, the supplies are going to come and which labs that we're going to use. So we are waiting still to get guidance from the state on how we are supposed to roll this out. But the nursing homes do have to have a plan into the state by Wednesday of how they're going just to do this. We also have had another kind of project from the state, and that's on the contact tracing. So I think I told you last week that we need to have about 35 tracers for the reopening criteria. And we had a call with them just on Friday. They are doing a new program where all of the people who are doing tracing will be in a new online training program. And so I sent the list that we have just for our county, and we have 37 people on our list. And so that went to the state, and they received an email from the state to do the online course. And so that's getting started. We will have to change the process that we do, and all of the contact tracing for the state will be in the same manner. And so they're going to kind of roll that out by a county basis. I believe, though, that we now have met the criteria for contact tracing to do the reopening. And I do believe it's just the testing criteria for North Country that the state is kind of waiting on. We've had a lot of conversations about what the reopening is going to look like. Last week, I did provide a slide that just shows what all of like the business plans should have in place to keep the employees safe and all of the people who then go to the establishments. So when we talk about a reopening, what we will see will not be what we were doing prior to this virus. And so we'll need to keep in place just all of the social distancing and wearing the masks. And we will be going by a phased kind of process. So when we are able to reopen, it is phase 1, which will be the construction, manufacturing, and curbside. And so we are getting a lot of calls here in our department for what kind of things can be open, but that's where we're going to be starting. And then we have to be monitoring what is going on, what is the case counts, what is the hospitalizations, to know then if we can move to the next kind of phases. So there's still the criteria, and I believe it's just the testing criteria. And so we are making kind of a rubric and to provide to the businesses here in the county to have them kind of go through some of those safety things, which do include looking at workplace hours and shifts, so you can try to spread the employees out, doing the social distancing, the non-essential travel type of the restrictions for the employees, wearing masks, doing strict cleaning, having health screenings in place, and then doing the tracing and tracking and the reporting of just cases or people with symptoms to the health department so that we can monitor that. And I do know that from this morning's talk at the state, starting on May 15th, landscaping and kind of gardening activities, outdoor low risk recreational things like playing tennis, and then the drive-in movie theaters will be opening at this time. We, as the local health department, will play a key role in just doing all the tracing and the testing to watch what's kind of going on, to monitor the infection rate just in the community and at the hospitals, and to ensure that there is the compliance with the businesses. So that's what we have going on right now. And if you have any questions, please let me know.
Should be.
The boardroom is muted.
Ms. Terminelli?
Thank you. I'm just wondering, I know that this is new and it just rolled out as far as what the local regional plan is going to look like, but what do we have to ensure the business compliance? Do we have protocols in place? Is there a hotline that people will call if there's businesses that are not following or that are not in compliance? Do we have those ironed out yet?
Ruth, maybe you want to speak to this, or I know it's the sheriff's office, Steve's office, and her that when there is the compliance issues now, I don't know if that's going to be the same piece that does move forward. I know the public health department will play a role, but we'll have to have some mechanism for just learning where there is a compliance issue.
Bill, I can speak to that if you'd like.
Are we
Can
on his
respond.
phone that we can't hear him very well?
I think we're having some bandwidth issues.
Okay,
But I can respond to.
okay, go ahead, you can respond.
To respond to that also, I think certainly to follow up on what Dana mentioned, the group that's convening, that's going to be chaired by our IDA director, Pat Kelly, is going to be looking at some of those responses. So Dana is working on the rubric by which information and thresholds would be met. And then I think looking at, we haven't received the guidance from the state yet to determine if they'll continue with the enforcement like we've had with this period of time, because the volume would expectedly increase. So we're going to take that group to look at those kinds of issues and come up with either a hotline or some solutions that give people options as we move in this direction.
Mr. Burke, did you have a question?
Yes, I did. Are there a list of businesses that will be published for the public to know what's going to be opened on the 15th?
I can speak to that.
Do you understand what he said?
Yes.
I think Ruth has it.
Go ahead, Ruth.
Mr. Burke, at this point, we aren't yet meeting the criteria for reopening, but we are working on those in the categories that Dana described and trying to assert what would happen in the event that we meet that testing criteria and we're given permission as of the 15th or whenever that is. I would think that we'd pull this together, we could put out for the public.
And can I follow up, Bill?
Yes, go ahead, John.
Then I guess the question would be, and it sounded from Dana's report, the issue is testing. How much testing is needed and what is the plan for that?
So for the requirement to be met, you have to test 30 people per 1,000. So that's about 3,000 tests or more for our county. I would say that during the last 2 weeks, we have been meeting this, but the problem is I don't know how long we can sustain that, and the hospital systems feel the same. So we have a request into the state for a state testing site, and we are waiting to hear back from the state. So we still feel like to keep that kind of level of the testing up, we would need a state testing site just to do so.
And I would also add that
Go ahead.
we are, our emergency services director was able to pick up in Malone today an additional 3,000 tests. So I think that the anticipation is that they're going to start sending tests our way. But like Dana said, it's going to be very quick that we overcome what our capacity is when we are there. So we do need some assistance once we even complete the nursing home component, much less the 2 times per week that's anticipated under the most recent orders provided.
And how, excuse me, how is the rest of the region doing for, because our reopening is contingent upon other counties, is that correct?
That is correct on the 7 counties. Dana?
So when I talked with the other counties on Friday, we are definitely testing more than all of the other ones. But they're all kind of with regard to the population for that county. So I'm not sure. So like Jefferson County has the same population. And when you look at the New York State testing website, they have a COVID tracker website. We've tested 1,500 people. At least that's what's on the website. And so I'm not sure where they are. They have said that they have, so all of the counties said that they could do the testing if they had the supply, but it is the supply for all of the counties that has been like what the issue is.
Thank you.
And each of our neighbors received 1,000 tests individually to our 3,000 today. So they indicated to us there was great interest in pushing those test kits out to help us meet that need.
Good. Thank you.
Mr. Lightfoot, how are you?
I think he's muted.
Joe, we can't hear you. Still can't hear you. Joe, I think push that microphone. No?
No,
There he is.
There you go.
I'm working now.
Yes.
We hear you now, Joe.
Okay. I attended a meeting this afternoon via conference. And at the very end of that meeting, this was brought up that we were a little short in the number of tests that we had to our credit, which is the only thing that is holding us up from joining those other 3 that were approved to start. You want to remember too that this does not start until the 15th. So between now and the 15th, the chairs and the other participants in the conference call today agreed to make a concerted effort to get the approximately 500 additional tests that we need under our belt in order to make that rubric. So I think that the effort will be there, and this is for John, hopefully to answer his question, that we will be successful in getting those numbers, and we will meet that rubric, and we will be okayed to reopen, so to speak.
Thank you. Tony Arquette.
Thank you, Bill. Just for clarification purposes, now when we say we, at this point now, we're talking about a regional group as opposed to just our county, are we not?
That's correct.
Thank you.
Any further questions? Mr. Akers? Go ahead, Kevin. Kevin, hold on, we can't hear you.
I'm sorry.
There
I
you
just want to
go.
go on the record to state that I am 110% against any type of hotline where citizens could report on any other citizens. Businesses that are eligible to open will have to self-monitor themselves, and clients that utilize those businesses, if they feel unsafe, then they won't go there. But I'm 110% against any type of hotline whatsoever.
Understood. Yes, Ms. Arquette, or excuse me, Ms. Arquette? Nancy Arquette?
Thank you. Dana, just a quick question on the testing. People at this point, people who want to be tested, do they still need to go to their doctor to get a prescription or, an order for the test? Or can they call public health directly?
So to get the nasal swab, which is the PCR test, you can call the hospital systems. There's lines there for all hospitals, or you can call our department. To get the antigen testing is the one that you have to call your own or the provider for a doctor's order.
Okay, perfect. Thank you very much.
Any other questions? Yes, go ahead, Margaret.
Thank you,
Ms.
Mr. Chair.
Haggard.
Thank you. That's okay. Dr. McGuire, is it a public health function to assure compliance with businesses? I know they mentioned earlier that the sheriffs were monitoring that, but is that also within the public health group's responsibility to make sure people are complying?
It's in the local officials, so we would be a part of that to see where the compliance is. Yes.
Okay, so how is that communicated to you? How is it? How do we check?
We don't have any guidance on that, so we need to come up with criteria. So like I mentioned, there will be a kind of rubric that we will set out to the businesses that they can fill out, and they can resubmit to us when they have their plans in place.
And in the meantime, you would still be monitoring hotspots should one occur that could be traced back to a business or an organization, correct?
Yes. So anytime we get a new case, we do an interview with that person. We learned where they have been, who they've been in contact with. All of that plays a role to what establishment might be
And I had one more thing I wanted to ask you about, and that is getting back to the testing. A lot of people have asked about this. Ruth mentioned we have 3,000 tests coming in. The federal briefing this afternoon said that anyone who wants a test is capable of getting a test. Is that supply chain full, or is it hit or miss? Do we know that after we burn through the tests we have coming in, that there's a backup to that?
So I believe the hospital system, so this is a better question for the hospital systems that do the testing, but I did talk to Dr. Williams. Because I asked about how often are the hospitals getting new supplies. We do get some into the EOC, but the hospitals themselves do the ordering. And so he said that they are being and they use more. He believes that they will have just even more and more of the supply in.
Thank you very much. Thank you, Mr. Chairman.
You're welcome. Any further questions of Dana? Yes, Mr. Perkins, go ahead.
Dana, when somebody is been contacted because they've been exposed, how has everybody been as far as willingness to cooperate in giving you the information of who they've been in contact with?
It depends. Most people are, they'll just give the information, but we have had some of the scenarios where we've had to call them back 3 times. They haven't wanted to answer the questions. They don't understand who they might have been in contact with, which we're not able to give that information in the conversation. Most people do kind of realize after we've had to call them 2 or 3 times, and they know it's just kind of part of the process. But it can be very upsetting, and so it does take time to let people kind of know that that they have been in contact, and kind of let them know just what the process is.
Thank you.
Mm-hmm.
Further questions? Oh, yeah, thank you, Dana. You're up for resolutions next.
Okay.
Let's move on to resolutions if there's no more questions. We have a resolution authorizing the chair to sign a marketing and licensing agreement with Walk with a Doc. Do I have a motion? Rita Kern motions and Dan Fay seconds. And we have Dana on board to talk about it.
So this is the annual contract that we have with Walk with the Doc. This will be our 3rd year. I can say that right now we don't have kind of the menu of all the dates because we're still trying to see just where we're going to be. But we will expire during this time period so that we do want to get a new contract when we can walk we can into place.
Any discussion? Yes, Mr. Akers.
What are the fees and who are they paid to, Dana?
They're paid to Walk with the Doc, and I don't believe the fees have increased. I'll have to take a look at it. It just gives us the right to use the Walk with the Doc logo, but I'll have to get the fees for you.
And is this a Department of Health? The Walk with the Doc is some trademark of the Department of Health here in New York State?
No, Walk with the Doc is, it was started by a doctor in Ohio. And so there are chapters just throughout the United States and in many of the countries as well.
It blows my mind that we would have to pay any type of fee whatsoever.
Any other discussion? All in favor?
Aye.
Opposed? Carried. We have a second resolution. Dana, authorizing the chair to sign a contract with Jack Vaneski, CPA and Associates, to prepare the preschool school supportive health services annual Medicaid cost report for Public Health Department for the July 1st, 2020 to June 30th, 2021 program year. Is there a motion? Mr. Dave Forsyth makes the motion, seconded by Rita Kern. Okay, go ahead, Dana.
So this is also an annual contract that we pay to the auditing service to do the cost report for the preschool program. And I believe this cost, the $4,500, same as it was last year.
Is there any discussion? Being noticed. Yes, go ahead, Nicole Terminelli.
Just wondering, I don't have that resolution. I mean, I see it on the agenda, but I don't have a copy of the resolution in my packet. I'm just wondering if it was left out of anybody else or if it was just on my end.
I've got that resolution on my agenda. Does anyone not have it other than Nicole?
Oh, no.
Just Nicole?
I feel
Rick
special.
Perkins?
Thank you.
Okay. Okay, so any more discussion? All in favor?
Aye.
Aye.
Opposed? Resolution carries. We have a third resolution, Dana, authorizing the chair to sign the 2020-2021 Emergency Preparedness Program contract for the Public Health Department. Do we have a motion? We have Nancy Arquette makes the motion, seconded by Tony Arquette, I believe, and Rita Kern. And go ahead, Dana.
Okay, so this is the annual contract for the emergency, the preparedness program. And this is the base contract. So all of the additional funds that we've been getting for the COVID response, they also come through this HRI contract as well. But I believe the amount we will see again this year will be $86,000.
Any questions on that resolution? All in favor?
Aye.
Aye.
Opposed? Carried. Next, we have a resolution proclaiming June as the start of a year-long campaign encouraging safe sleep practices and well child care in St. Lawrence County. I think Heather, can you take that one on and give us some information?
Thank you, Mr. Sheridan. Good evening.
Yes.
We need a motion in this.
Oh, excuse me, we didn't get the motion. A motion by Nicole Terminelli, and Mr. Burke seconds it, and now go ahead. Go ahead. Sorry about that.
Thank you. This proposed resolution supports the efforts of the Child Fatality Review Team. The team's mission is to review reported child fatalities and to promote child safety. Too often in St. Lawrence County, unsafe sleep practices lead to child fatalities or near fatalities. I am encouraged by the team's efforts, and I'm a member of the team, to educate our community and ask that this resolution be considered.
Okay. Any discussion? No discussion?
Jim.
Yes, wait a minute, Jim Reagan. Go ahead, Jim.
Mr. Chairman, could I ask Heather how many fatalities we've had over the past couple of years due to unsafe actions of this sort?
Sure. I think I can report out pretty accurately for the past 4 years or so. We have at least 2 every year, and sometimes more, that we at the Department of Social Services are aware of and are asked to investigate and provide supports to families. But there may be others that we're not aware of, where a Child Protective Services report was not called in.
So it's fair to say that if more families were to practice safe sleeping habits with infants, that we could not have so many children dying needlessly, and create the repercussions that must have to a family, knowing that the parents or family played a role in death of that.
Absolutely. It's very important work that the child fatality team is doing. If we're even educating one family, it's worth our efforts, absolutely.
Thank you.
Any further discussion? All in favor?
Aye.
Opposed? Carried. Next, we have COVID-19 response update discussion on the agenda.
Thank you.
Heather?
Thank you. So I'm grateful for the opportunity to discuss our ongoing efforts at the Department of Social Services and would preface that with a profound appreciation for our county partners, providing the expertise and tools that have allowed us to get the job done. It has truly been a team effort. And throughout the pandemic, the Department of Social Services has been open to the public, and we continue to make home visits in our community. Although we make our best efforts to provide remote assistance when we can, it is not always possible or prudent for us to do so. Our security guards and front desk staff screen, greet, and assist folks who come to us when they are homeless, need basic necessities and services, and are at risk. And although each day we have approximately 25% of our 230 staff working on site, the remainder of our staff are working remotely, answering calls and determining eligibility for services from home. For our child welfare and adult protective teams, over 50 caseworkers continue to make home visits. They are our first responders and are intervening, often in dire situations, to ensure that children and vulnerable adults are safe. The nationwide trends indicate that instances of domestic violence, drug overdoses, and mental health crises have increased during the pandemic. Virtual Family Court has allowed our child welfare and legal team to continue to file petitions as needed to protect children and families. Unfortunately, the needs for orders of supervision and foster care have not diminished. Since remote work options were utilized for our child protective services workers in mid-March, our number of active CPS reports have reduced by over 100. Our staff are making excellent use of their time at home, and increased productivity has been noted in several of our program areas since we started working remotely. So I'll give a few highlights. Temporary assistance, I've been keeping a close track on our safety net cases, and some of you I'm sure are aware already that we received the lowest state reimbursement rate for these cases at 25%. And we have similar numbers to last year at this time. They've increased by just 30 cases since February. So that's a bright spot. The HEAP season was extended due to COVID from April 24th to June 20th. So despite the increased work that this extension has created for our staff, we've continued the planned scheduled departures of the temporary HEAP workers, with our last temporary staff scheduled to depart this Friday. The Supplemental Nutritional Assistance Program, formerly known as food stamps, as anticipated and in line with state trends, we've seen an incredible increase in SNAP applications, 40% in late March, and at the end of April, we were still at a 32% increase compared to early March. Our remote staff are processing the extra work efficiently, and most of our applicants are waiting just a few days before they receive benefits. Our child support staff will be busy in the coming weeks processing tax intercepts for stimulus checks. And our pending positions, we have 11 vacant positions with permission to fill, and we've opted to hold 7 of those until we return to full staffing in the office. And we did not bring any positions to vacancy this month. This has not been an easy time. It's a true privilege to work with such a flexible, knowledgeable, and talented team throughout the past 2 months. In my discussions with other commissioners throughout the state, I have heard stories of acute struggles with remote work, staffing, and administrative support. I feel beyond blessed. And I thank you for your continued recognition of and interest in the Department of Social Services. And I'll make my best efforts to answer any questions that you have.
Yes, thank you, Heather. John Burke, go ahead for the first question.
Oh, hi, if I could ask Heather directly.
Yes, go ahead.
Heather, you talked about domestic abuse from the statewide statistics being on the increase. Do we have any local data or even anecdotal data that tells us how we're doing here in St. Lawrence County?
I don't have any data specifically, although I think we could certainly access that by looking at reporting that may be coming in. Anecdotally, yes, we're seeing an increase and some really severe, significant situations. I think anytime you have additional stress, folks who may have some mental health struggles, anxiety, depression, that these types of situations tend to make them more challenging. And of course, we have a lot of people who are at home for, most of the time, which may be unusual for them.
Is there anybody reaching out to us for help that we're unable to help? In other words, unmet needs?
I think we have people who are waiting to receive unemployment benefits, who are either not eligible for temporary assistance or would have to perhaps put a lien on their house or look at their resources in order to be eligible. I think that's an unmet need right now. I've been encouraged to see so many of our community members reach out for help with food. I think that's great. And of course, we've seen in our communities, the schools making extraordinary efforts to assist families as well. Most of the service providers that we either contract with or refer clients to are continuing to provide services, albeit remotely in a lot of situations. So mental health, for example, you mentioned domestic violence. So Renewal House continues to assist clients over the phone or via video conference. So there are a lot of options. Sometimes it's just a matter of helping people navigate those options to figure out how they can continue to get the help that they need.
Thank you. Thank you.
Thank you.
Margaret.
Thank you, Mr. Sheridan. I wanted to, for the record, point out that I'm recusing myself from this discussion. And I did not vote on the resolution brought up by Ms. Wenzel in the last few minutes, just for the record. Thank you very much.
Thank you. Jim Reagan?
Heather, I want to commend you and your staff on your turnaround time on the SNAP benefits. I have a question. If someone is unemployed and waiting to hear on their unemployment benefits or pandemic unemployment benefits, would they have to get a lien on their home in order to qualify for SNAP benefits?
No, they would not. So the resource check is only required for temporary assistance. So I would encourage anyone who's struggling to have enough food at home to apply. They can do that online if they choose, or they can call us here. There are a lot of options that are not too challenging to apply for SNAP.
Thank you. I know every day I'm talking to families that are frightened because it's been 6-8 weeks that they've been waiting for their pandemic unemployment or regular unemployment checks to arrive, and they're looking. They're not quite sure what they're going to do in terms of feeding themselves and their families. One individual I spoke to was down to some Bisquick in the house. So I think it's important to get the word out there to these families that are struggling and are genuinely frightened that the SNAP program is available and that there's no shame in applying for this federal assistance that is available to them so that they can feed their families during this time of crisis. And, you know, I want to thank you and your staff for everything you're doing and encourage, you know, my colleagues to help get that information out that they should refer families to the social services and the SNAP benefits.
Absolutely. We were just talking today that we had heard a few members of the community who were confused about whether we continue to be open for business and whether people can continue to call. So I think we may issue a press release just to make sure that everyone's aware that we're here, we're open, and that we want to help.
Yeah, and if you could, you know, specify which parts to call
Yes.
or what kinds of assistance, I think that would be very helpful to your staff so that not everybody's coming in on the general switchboard number, but, you know, knows to call the right departments for the right kind of assistance.
Absolutely. And so many services now can be accessed online as well. So in years past, to receive benefits from social services, folks had to actually come here to our offices to apply. And a lot of those requirements are no longer relevant. So I think sometimes people think, well, I would have to go there and I don't want to do that, when really that's not the case. So we can try to make our best efforts to educate our community about how easy it is to see if you're eligible for programs such as SNAP.
Thank you.
Are there any more questions for Heather?
Rick Perkins.
Mr. Perkins?
Thank you, Mr. Chairman.
Go ahead.
Heather,
I got you.
there's a lot of people that aren't getting their unemployment that still have bills to pay.
Yes.
Is there any way that they can get some sort of monetary help? Maybe sign some sort of legal document that when they get their unemployment that they would pay that back? Is there any type of program like that that we could initiate?
So as far as temporary assistance, there are some people who could be eligible for temporary assistance. And it may be that they would have to pay that back after they received their past due unemployment benefits. It really depends on whether folks have resources or not. If you have a car, if you have a home that you own, it is a lot more difficult. And the temporary assistance benefits are quite small. So an average person might receive between $200 to $400 a month. So it may not be enough to cover someone's bills, unfortunately. I think that SNAP is a really great option for people who do have resources, because at least it alleviates need in one area so that perhaps they can use some of the funds that they may have available to pay their existing bills. But unfortunately, there are not a lot of options.
Thank you.
Are there any there, Tony? Go ahead, Tony Arkwood.
Thank you, Mr. Sheridan. I just want to dovetail off Legislator Reagan's comments that I think that the key here are that there are so many people that may have recollected how it used to be, back in the day, because they've never had to pursue any types of benefits. So I think a very public informational point on exactly what numbers to call for specific needs, I think would really help. Regarding Rick's comments, and certainly, this is such a time where we don't want to be behind things like payments or everything, but I think primarily getting food in children's mouths right now and making sure families are being fed are the number one priority. And, I think that if we make it very clear and navigable for all social services, I think that will help greatly in making sure that there's no hungry children going to bed tonight. Thank you.
Absolutely. And I think families, if they're not aware of the programs that the schools are offering as well, that's a great resource. I will work on that tomorrow.
Any further questions of Heather? If not, thank you very much, Heather.
Thank you very much.
Great job.
Thank you.
We'll move on to,
Yeah, Dylan's gonna bring
we're
Jay.
gonna do- hang on just a second.
Dylan?
Oh, he's on.
Is he on? Can we come up?
Ready?
So we can hear
He's
him
here.
if he's muted or not.
Okay, Lisa. Okay, Jay Ehrlich is up next. We got a community services report or a monthly clinic update. Go ahead, Jay.
Yep. So Ruth asked that I spend a little more time and go through this with you this evening, and happy to do that. So we'll start, this is for the April report. We'll start by looking at the no-show rates. No-show rates continue to decline, both in the chemical dependency clinics and in the mental health clinic. I think for the clients that we do have engaged in services on the chemical dependency side, I think that we are having better attendance, possibly because of not being tested for their drug use. I think possibly to a fault, we've had more individuals attending the virtual meetings that were obviously inebriated or under the influence. I think, for someone who's addicted to substances, I think taking the substances makes them feel normal on the inside, but I don't think that they understand how obvious it is to other people in terms of watching their behavior that they present during the meeting. So there have been times we've had to ask people to disengage in that particular session or group as a result of them being intoxicated. So if you look at the clinic counselor visit averages per day, the chemical dependency average has remained flat. If anything, it's gone down slightly from previous months. It was 3.42 in February and 3.40 in March. Whereas the mental health numbers of clients being seen per day have increased from 4.43 in February and 5.6 in March. Mental health patients are typically, more stable in their participation. It's more long-term. They stay engaged for longer periods of time. The turnaround for chemical dependencies is much quicker. So because of that, not having a solid referral base right now, I think that, has, an effect on the numbers and has had an effect on the numbers. Certainly, one of the biggest differentials between the two is through attrition, we went from 6 mental health clinicians down to 4. And on the chemical dependency side, we continue to have 8 clinicians providing services. Approximately 20% of the schedule on the chemical dependency side is empty. So that accounts for obviously some of the low numbers there. But again, in terms of our referrals, we're no longer getting as many DSS income maintenance referrals. Certainly jail referrals are down. Court referrals, which are affected through probation, and our DWI program are down. And another piece of this is the inpatient rehabs had to cut their census by half. So there's not as many people coming through the rehab, so that referral source is down as well. So, you know, we're getting about 2 to 3 referrals a day. We used to get upwards about 6 a day. However, today we did get 7 referrals, so there was a little bit of a spike today, and you know, it is unpredictable. You know, not having a wait list, you know, makes you very subject to being dependent on the number of referrals that are being received on a daily basis. Is there any questions about the visits per day?
Yes, go ahead, John Burke.
Well, I don't know that it's specifically about visits per day, Jay, but I guess I'm wondering about the overall need. I mean, we heard from social services, from Heather, that the mental health needs were up. There's an increase in domestic violence. I guess I'm wondering, where is the need right now? If we were just to look at the tables that you put forward, it would give the appearance that the need is actually decreased. And I guess I'm wondering what your assessment of that is.
The need decreased on the chemical dependency side? Is that what you're referring to?
Both, Jay. Both.
Well, again, I mean, we're getting fewer referrals on the mental health side as well. So it's not just on the chemical dependency side, but the mental health folks are typically more voluntary, so they more readily attend, whereas many of the chemical dependency individuals are more mandated. You know, I think that there remains the need out there. I just don't think that they're being connected to services, you know, right now. You know, for the mental health side, I think, you know, there was a little bit of a honeymoon period for the first 3 weeks. I think, you know, there was a novel change in terms of not having to go to work and having the kids home. But over time, you know, we're seeing that, you know, they're becoming a little more unsettled and, you know, having increased anxiety, increased depression, particularly as the numbers of COVID increased, you know, not only in our county, but across the nation. So they are some of the people who used to be seen twice a week are asking to be seen more frequently. The men, you know, are more talkative, they're more open to discussion than they were before, whether that's because they're more isolated and just, you know, value that ability to talk with someone more. But that's helpful in terms of making assessments and getting information, ongoing assessment and getting information. I think on the children's side, it's been a challenge because it's hard to kind of keep a child kind of glued to the TV screen when you're talking therapy, as opposed to doing some sort of a interactive therapy game. So they've been challenged to come up with creative workarounds for that. But, you know, I think, you know, and another thing in terms of an advantage of the virtual clinics is you get to hear some background noise. You get to kind of pick up on some patterns of communication, interactions that you might not otherwise have in a face-to-face session, and also see the home environment. So I don't know if that answers your question, but.
Well, I guess my sense is that there is still, and I think you just said it, Jay, an unmet need that's out there. And I guess I'm wondering how we take measurement of that and how we might respond to it. I don't have any great ideas, but it would seem to me that with the additional stressor of the COVID epidemic, that mental health, the needs would certainly not be decreasing. And I'm sorry.
Yeah, absolutely. I understand. Just in terms of trying to get the word out, for our clinics, we've done several press releases. And we plan to do some advertising in the future for our clinics. I think, in terms of the chemical dependency side, I'm hearing from other providers that they're not getting the amount of referrals either, and that they also have, holes in their schedule. One program talked about their nurse practitioner whose schedule is not full, which was something that they did not anticipate, in light of the opioid epidemic. So, I don't know, people are just kind of avoiding treatment and or hunkering down and not seeking out services at this time, is my guess. I think, we have had an increase in our clinic for some MAT services, for some Suboxone services. I think that's in part because of some law enforcement efforts, and also people aren't traveling as much and able to readily get the street drugs that perhaps they could have several months ago. So there is, in our clinic, we have an increase of MAT services more recently.
Thanks, Jay.
Margaret, go ahead.
Thank you. Mr. Chairman, Mr. Ulrich, I could see how referrals for substance abuse might be down in terms of DWI because people aren't out and about, the bars aren't open, people aren't in their vehicles. But at the same time, my understanding is that community-based 12-step programs aren't meeting at the rate or frequency than they usually do. Are you anticipating that this is going to cause a sort of a huge blip after things get back to normal? Or have you heard anything in regard to, I'm sure you tie in with these programs somehow?
I think we've had this discussion today with my program directors, and we are anticipating an increase in services. But at the same time, I didn't necessarily think we were going to have a decrease in services during this time either. Maybe initially, as things, paused, but, we were hoping that things would pick up and they have not.
Thank you.
Yes.
Rick Perkins, go ahead.
Thank you, Mr. Chairman. Jay, I'm looking at the chemical dependency visits per 7 hours. Month after month after month, these numbers aren't changing. Why is it that they're not even doing half-day visits? Do we have too many counselors? Are people not showing up? The no-show rate looks like it's decreasing. Are we serving enough people, or do you know why it's staying flat?
Well, I think we're just not getting the referrals to fill up their schedule and to keep them busy. So at that level, yes. And that's, I mentioned earlier that, through attrition, we went down from 6 counselors on the mental health side to 4, whereas on the chemical dependency side, we've remained at 8 in spite of the drop off of referrals. But it's not even, this even is pre-COVID. That the numbers have been low. So I can't necessarily pin it totally on COVID either.
Right. I'm not pinning it on COVID. All last fall, we had this same issue, and it's within the chemical dependency, it seems. It just seems like maybe we have too many employees if we're counselors, if we're not, they're just not filling up their day with work as far as visits go. And that's where the money is.
Well, I've even directed the chemical dependency program director to identify those that are, struggling right now, and instead of seeing them once a week, see them twice a week. So that's, if it weren't for doing that, we'd probably be even in worse shape right now. So yes, the clinician versus referral ratio is not, synchronous at this point.
Okay, I do understand it. I know that you've got a tough job and a long road, but I do appreciate the work that you're doing. Thank you.
Mr. Burke.
Jay, this may be an untimely discussion, but the methadone clinic would certainly be an answer to any underutilization and provide a much needed service as well as stabilize the operation. Do you agree, or do you have different feelings?
I mean, I believe it has the potential for that. But, anytime you open up a new program, it's a fairly, existential leap. I did reach out to all the providers, both in St. Lawrence County and Franklin County, and try to get the numbers, ask the questions in terms of those people who aren't being stabilized on Suboxone, meaning that they're not being able to be given a 30-day script, but rather a 7-day script or less. And the numbers came back. There's just approximately 170 to 190 of those individuals between the two counties. And that is not taking into consideration the tribe. And talking with Oasis, about the $250,000 SOAR monies that they made available to the clinic, I've gotten written confirmation from them that money could also be used by a private nonprofit organization as well. In terms of, the county venturing down that path, if we have less numbers in our chemical dependency clinic, we have an increase due to the opioid treatment program, that some of the state aid could be also transferred to support that endeavor.
Any further questions of Jay? Yes, go ahead, Mr. Burke.
Just a follow up to that. I think, Jay, I don't know whether you've given this any thought, but for me, the risk in having another non-for-profit, and my understanding there's only one looking to do that, and that non-for-profit has no experience either in providing a methadone treatment, but over the long run, we have no idea for a non-for-profit whether or not they will sustain the effort. I mean, they could take startup funds and then maybe a year and a half, 2 years down the road, pull out. Is that accurate?
Well, I think the only reason they would do that is it would not be sustainable, and that they didn't get the numbers, in order to cover the overhead of the operation. I don't think that they would just, be interested in doing that program for the sake of the SOAR monies. But I think, like any program, there is risk when you start something new like that. But historically, like I mentioned before, they typically, do well, if you have a certain number of individuals participating.
Any other questions? Yes, go ahead, Rita Kern. Rita?
Thank you, Mr. Chairman. So what I've noticed during COVID-19 in referrals that I've had to give and people that I've dealt with is I think that some of the attendance and chemical dependency is down because people are using more, like falling off the wagon and using more right now. And I think that Jay is right. When this comes to an end and things start to normalize, I think you're going to see an uptick again in the people that are going to have to go through rehab and get back on the wagon, so to speak.
You mentioned rehab, Rita. One of the, it's kind of a whole new world. So one of the things that, what we think is happening is when people are being discharged from rehabs, I mean, let's say St. Joe's. I mean, they now have the capability to refer them to their own clinics, regardless of, you know, their place of residence, because of it being virtual. Before, it would be, okay, you live, you know, in Potsdam or Canton, we're going to refer you to one of those providers. So, you know, it's a double-edged sword, because it opens up at some level a level of competition that we did not have before.
And if I may direct back to Jay again, what I'm seeing in the community is just that. If your patient goes into rehab, they come out somebody else's patient.
Mr. Burke.
I don't know, Jay, about substance abuse, but certainly mental health. That was something, you know, all the accrediting agencies were all concerned about continuity of care, and that when they go in for an acute stay, rehab or inpatient psychiatric, the expectation was that they would return that individual to the clinician who had established a therapeutic relationship with. Is that not the case anymore?
I think it's still predominantly the case on the mental health side, yes. But, you know, because a lot of those mental health patients had long-term relationships with the clinicians. Like I said, the chemical dependency clientele are, I want to say, more transient, but they're in and out of treatment more frequently. You know, they might start treatment and then they might fall out, and then they might, you know, for whatever impetus, whether it be probation or the courts or whatever, you know, they would rejoin and recommit to another episode of care. Whereas mental health patients are more consistent. So because of that longer term relationship, I think there's more of a sense of that continuity and a similar referral system prior to things becoming, you know, more virtual and done through telecommunication. So yes, I think you're correct, John.
Thank you.
Rita Kern, you had a question?
No, I was just going to say that something that I've noticed lately is there seems to be some insurances that are changing who covers or who is covered by their service. So I've noticed that I've had a couple of patients that have complained that their outpatient psychiatric provider has been changed for them by their insurance.
I mean, that's a possibility. I have not heard that, but that could be. So,
and I can give you a couple examples later, Jay, not of patients, but of like companies off here, companies that it's been a trend with.
So previously, when I asked if there was any questions, I wasn't completely finished with discussing, you know, the update. So if I could continue, if there's no more questions at this time, can I do that?
Yes, go ahead.
So if you move down below the no-show rates, you have the visits per 7 hours, and underneath that you have weighted visits. So the difference between those is the number of visits per 7 hours. It could be a 45-minute session, that could be an hour session, or that could be a 30-minute session. But if you look at the weighted visits, so if you take the very middle employee 8167, that counselor had 3.70 average patients per 7 hours, which comes out to about 53% if it's all weighted evenly. But if you'll see in the weighted visits, that person comes in at 50.4%. So what that means is that person likely had 2 or 3 30-minute sessions as opposed to a 45-minute session or an hour session. So the weighted visits is actual face-to-face billable time, which we set an expectation at of 72% for the clinics. So the average billable or face-to-face percentage for chemical dependency across the board of all the 8 counselors is 47.7, whereas the average weighted face-to-face contacts for mental health is 72 or 74.2. So, mental health, has, really been working at a pretty fast clip, to meet that production standard. They seem to have, pretty much settled in and adjusted well to this new system of care. So they've done a good job. If you look at
Go ahead, Jay.
if you look at the prescriber visits, they're continuing to go up, which is a good thing. The first one that has 8.43, that is our medical director. And she, in addition to seeing clients, she also, during that 7-hour period, is responsible for signing, all the treatment plans for the mental health individuals, signing off on that, and then also does supervision times for our psychiatric nurse practitioner. But last month, the employee 7792, which is our nurse practitioner, she was at 8.0 and has jumped to 10.25. And the locums tenens has gone from 8.79 last month to 11.44 this month. So, there's been some gains there. So.
Rita has her hand up.
Who wants? Rita? Go ahead, Rita.
You're muted.
I didn't have my, I'm having technical issues here, so I'm trying to direct. Sorry.
Okay, that's okay. Yes, Mr. Forsyth.
Jay, when you go back to the weighted average, you're achieving your weighted average with 4 employees on the mental health side. And with 8, you're at about 60% of your, by my math, I guess, 60% of your weighted average. Why wouldn't you just reduce staff by 2 or 3? And you'd achieve your percentage. It's not like you have the waiting list to pick up the slack. Why wouldn't you just reduce the staff?
Well, I think, that decision would probably have to be vetted and authorized by the board, and then subsequent to that also by OASIS. OASIS has made it extremely clear that they do not want any changes in staffing patterns until you submit a justification of such and have their approval, to the point where they're threatening I wouldn't say threatening, but they're making it clear that you have the potential of losing state aid if you do decrease your staff numbers without their permission. Because if you decrease your staff numbers, there's also the potential of decreasing, your production numbers, potentially. And your state aid is really based on the number of people served. So that would have to, you'd have to have a written presentation to OASIS and gain their approval to do that.
Yeah.
Yes.
After Dave. Can I follow
Go
back?
ahead. Go ahead, Ruth.
Jay, can you update the board as well? When we last met, we were going to ask OASIS to come and join us. Can you provide them with how that conversation went?
Well, I think OASIS is, I think number one, I think they shy away from presenting to the legislative boards. And I think, one of the things that, and they're kind of putting their money where their mouth is in terms of allowing us to use the $250,000 for the SOAR money. So I think, that speaks volumes in terms of them feeling that, the county and surrounding counties could benefit from an OTP. I also think that when a provider, whether it be the county or another provider, is making a proposal to expand a service or to open up a new service, it is really their responsibility to demonstrate the need, not the responsibility of OASIS to demonstrate the need. So I think that they know I think they feel strongly there's a need, but I don't necessarily think that they feel it's their role to convince providers, and or board members of that.
Thank you.
Any further questions?
So there is a change. I looked at the very last, at the bottom of page 2, I looked at the month of September, and the reimbursement rates that were being paid was down to 80.76%. And there was some, I don't even say glitches with Fidelis at that time when it comes to the chemical dependency side. And we had to change the way we did our billing. Had to bill through the medical director to get reimbursement. There was also some difficulties with some of the startup codes for the telepractice that we were doing. So we ran those numbers, and that 80% actually is 89.01%. So that's a correction. The very last thing, I have is, I did, wanted to circle back around. I had made, 3 proposals, for trying to alleviate some of the county costs, that being status quo, but continue to, work on the billing and the production. The second being to transition the Messina and Gouverneur satellite clinics to their main PRUs, that being Ogdensburg and Canton. And then the third being to transition those clinics, but then also look at opening an OTP. So, even during COVID, and, post-COVID, I still feel that transitioning, the satellite clinics back to the PRUs would be my recommendation. Again, the caveat being, because everyone else is that, we did have a leg up on this. We had a jump start on, virtual clinics. We got into it as soon as OASIS changed their regulations last year. I think that because of COVID, I think there's probably going to be a lot of other agencies. They're going to probably fairly quickly catch up. I know that there's been some discussions about, post-COVID, it's going to be difficult for the O agencies to go back to the restrictive regulations that they had prior to this, because there has been an uptick in people engaging, in-home services. I don't know if, certainly I don't think all the waivers, the regulations that they've given relief to are going to continue, but there's likely that some of them will.
Rick has his hand up.
Rick Perkins?
Thank you, Mr. Chairman. Jay, can you remind me, what are PRUs?
Oh, they're program reporting units. So really, they're the main clinics. So Ogdensburg is a main clinic or a PRU, and then they have a satellite of Messina. And Canton is a main clinic and has a satellite of Gouverneur.
Thank you.
Yes.
Mr. Akers? Mr. Akers?
Thank you, Mr. Sheridan. I actually have to leave this meeting. I have to attend the Town of Waddington meeting. I be speaking in citizens participation. So I know that this discussion is not over, but I do know that you have committee reports. And I think if you allow me, I think the Board of Health with Dana's presentation and what Jay Ulrich is actually presenting now would cover those meetings. If I may, when my presentation gets done at citizens participation in the Town of Waddington, I'd like to rejoin, and it'll probably be during Mr. Denise's operations meeting. So at this time, with your permission, I would like to leave and enter the Town of Waddington meeting.
You have my permission.
Thank you, sir.
Okay. Any further questions or anything else, Jay, that you want to contribute?
No, I don't think so. Thank you.
Okay, then thank you very much, then, Jay. It's been very informative.
Thank you.
We'll move on. You probably want to give your administrative report at the operations meeting?
I will.
Okay. And the other thing is committee reports. Start out with, Mr. Akers just left, just in time. He knew he was gonna have to give a couple reports. So the Board of Health is what Mr. Akers would have reported on, but then we come up to CDP Board of Directors, Mr. Lightfoot. Do you have any report, Mr. Lightfoot?
He's still muted, I think.
Joe Lightfoot?
You unmute?
Joe, I think you're on mute.
There we go.
I think I got you now.
There you go.
Okay.
Community Services Board, CDP Board of Directors, Joe.
I was unable to connect with them, much as I was unable to connect with my laptop tonight to this meeting. So I have no report from that meeting.
Thank you. Next would be Office of Aging Advisory Board. Mr. Denisha, any report?
Mr. Chairman, I have nothing to report.
Thank you. And the last one is Youth Advisory. Ms. Terminelli, do you have anything there?
I sure do. We had a meeting on Thursday, April 30th via remote conference, and Ms. Backus, our new director, just brought everybody together just to kind of get some baseline information on the youth board, as far as how often we typically hold meetings and bylaw review, stuff like that. But some exciting things that I wanted to share with you is she has created some social media accounts to share the work of the youth board. So St. Lawrence County Youth Bureau is our Facebook handle, and we do have an Instagram handle as well. St. Lawrence County Youth Bureau with underscores in between. We have a beautiful new logo, and I don't know if I can show it to you on here, but there's the logo that has been designed that will be on all of the marketing, social media, anything that has to do with the youth group. Right now, it's kind of whether or not summer programming will happen or not is kind of up in the air. So they're looking for alternatives for possible fall programming. Also maybe looking at how the youth board could work with the Office of the Aging to provide some alternatives. And the final thing is they are trying to grow the number of board members that are currently serving on the youth board. So applications have gone out. There was a fantastic press conference or a press release that went out. In addition to adult members that we'd like to grow our numbers for on the board, they're also looking for youth applicants. So they would like to have some representation from youth across St. Lawrence County to sit on the youth board. That information is going to be going out to schools, but if anybody knows of any candidates, both adult or youth side of it, that would like to sit on the youth board, we are actively recruiting people, and our next meeting will be May 21st.
Thank you, Nicole. Any questions from Nicole? Okay, we'll move on to does anyone have any old or new business? There be no old or new business. We probably will do executive session material in the operations.
Yes.
So we won't be discussing executive session matters. Is there any further business to come before the board? Then we are adjourned.
So let me switch. Or I can grab it.
Back to the fray. Where'd Hunter go?
We're all set. Good evening, everyone. Call the May meeting of the Operations Committee meeting to order. And can I get someone to offer a motion for the approval of the agenda? Mr. Perkins and Mr. Fay. All those in favor?
Aye.
Opposed? Carried. Could I get someone to offer a motion for approval of minutes of the April 20th meeting? Mr. Perkins and Mr. Arquette. All those in favor?
Aye.
Aye.
Opposed? Carried. Before we get started, I just want to, I know it's belated, but I want to wish all the mothers a happy belated Mother's Day.
Thank you.
First off, the first resolution is from planning, the Jason Fotenhauer. And the resolution is authorizing the addition of 6 parcels totaling 583.3 acres to agricultural district in St. Lawrence County. Could I get someone to make a motion? Ms. Curran and Ms. Arquette. Jason?
Yes, thank you very much. Good evening, everyone. This is a resolution that you see every year at this time. We do our review in the month of March, from March 1st to March 30th. Individuals are allowed to add new parcels to their agricultural, to the county's agricultural districts. So this resolution identifies 583 acres of land, predominant, or all of it is in agricultural district 2, which is in the northern and eastern part of the county. And these parcels were vetted by the county's Ag and Farmland Protection Board, and once approved by this board, then they'll be forwarded to the county department or the State Department of Ag and Markets.
Okay, Jason, I know you've. I know there was a map of the districts that was attached to the agenda. You wouldn't happen to have an electronic copy of that you could show us?
I can't. I'm wondering. I know that was presented in the board packet. I can get to it, but I'm wondering if Dylan might have it there, or if the board packet could be shared. If that's possible.
Jason, I don't have it up right now, and I'm rebooting, and I changed my host duties over to someone else.
Okay. If you
okay.
Do you mean right now, Claire?
I can describe the map if that's okay, or if you want to bear with me, I probably could pull it up relatively quickly and share the screen.
Yeah, I don't think it's necessary to do that, Jason, but perhaps you could just give us a brief oversight of the map.
Yeah, happy to, Larry. The map shows the entire county, and it identifies in gray the agricultural district parcels across the county. There are about 600,000 acres of land in agricultural districts, broken up into 2 districts. The southwestern district is District 1, and the northeastern district, District 2. And on the map, it identifies the 6 parcels in 2 or 3 towns: town of Brazier, town of Louisville, town of Stockholm, I believe, I'll have parcels that are being added to the district that include the 583 acres.
Does anyone have any questions for Jason in regards to this resolution? Yeah, Mr. Manelli.
Is it the owner that requests that their parcel be added to the ag district? Is that how that works?
Yes, that's exactly right. Yeah, the owner has to make that request.
Any additional questions for Jason? There being none, all those in favor?
Aye.
Opposed? Carried. The next resolution would be a resolution modifying the 2020 budget for the Planning Office for Public Transportation Service. Gotta get someone to move that. Mr. Perkins and Mr. Fay. Jason?
Thank you. This resolution identifies some funds. $100,000 was received from the Department of Transportation for a payment that actually dates back to 2018, but just recently received. And the money is broken out a little, in two segments. $32,624 will be reimbursed to the county, and the remainder of $67,376 will be passed through to another entity, a subcontractor that the county works with, the Arc of Jefferson St. Lawrence, who is our primary transit subcontractor.
Great. So anyone have any questions in regards to this resolution? Mr. Forsyth?
Jason, is that normal? 2 years back, the 100,000 and the money just being appropriated now?
I wish I could say it was not normal, David. I'm working with DOT. There has been quite a lag, unfortunately, with the funding reimbursement from DOT. I think that they are working on it, but we are signing contracts. We just signed a contract for 2019-2020 funds. Just I think it was last month. So they're that far behind in their contract letting and authorization. So the funding always comes after the contracts are executed. So yes, unfortunately, we'll see this for some time into the future.
Well, I guess you're giving me hope that my stimulus check is still in the mail then, I guess. So
Well,
I got my fingers crossed.
I can't comment on that.
I'm just hoping. Thank you.
You're welcome.
Any other questions for Jason? There being none, all those in favor?
Aye.
Opposed? Carried. Next up, Jason, would be a discussion on the how the COVID-19 pandemic is impacting the public transportation.
Thank you. Yes, I know we've given a few updates in the past, but just wanted to bring everyone up to speed on where we're at right now with transit services and COVID-19 protocols. We are still continuing our standard procedures of ensuring that all riders that do get on a public transit bus are wearing a mask. We have safety shields blocking the driver. They're a clear plexiglass, blocking the driver from passengers that do get on. We have a limited number of seats available on each bus, and we are still operating the buses in tandem. So if there are a number of individuals that have to get on at one stop, then we can still follow the social distancing protocols by splitting up those riders onto two separate buses to allow for that separation. The ridership numbers have declined. As you can imagine, we on average have a little over 2,200 riders per week. This past week, the week ending this past Friday, the 8th, we saw 385 riders, which is actually a little bit of an uptick For the majority of the month of April and early May, we saw about 300, 320, 330 riders on a weekly basis. So that's it's a shadow of what it used to be, but there is still certainly I think the need for the transportation services, and we are doing that, we feel, in a safe manner. To break down who is riding the bus is a question that we often get, and we do have some statistics for a 3-week period from April 13th to May 6th. There's some survey work done, and we determined that the majority of the riders on the bus system were individuals that were going to retrieve groceries. So about 57% of the ridership during that time were individuals going to get groceries. 22% of the ridership were individuals going to places of employment. About 5% individuals going to medical appointments, and about 1% individuals going to retrieve prescriptions at pharmacies. So a pretty wide margin there, but the majority of individuals going to see to get groceries. I'm happy to answer any questions on the COVID response. I do have 2 other quick items on transit that I would like to share with you at this time, if there are any other questions.
Yes, Ms. Haggard.
Thank you, Mr. Chairman. Are the riders required to wear masks on the?
Yes.
Okay, thank you very much. Thank you. That's all I want to know.
Mr. Burke?
Jason, how would we go about compiling a comprehensive assessment of need in response to the corona epidemic, with particular focus on the challenges faced by individuals, families, and small business? And it's, again, I guess it's with the assumption that to take any action to reach out to help our constituents, the people of the county, we need to have a base of information. And I guess I'm just wondering what your thoughts are. How would we go about compiling that in a short period of time?
Mr. Burke, I think in a short period of time, that the best way to do that would be some sort of outreach, telephone outreach to existing agencies now that are dealing with the biggest, those individuals that are struggling the most as a result of COVID-19. So I would envisage some sort of a phone tree, contacting Department of Social Services, church and community programs, community services, other service, health and service agencies, public health, certainly. That, I guess that would be my first blush approach to do that, to try to get an assessment of what we have heard the need is that's out there. Of course, we all hear anecdotal stories about this issue, that issue, funding not being available, access to care not being available. But I think really to get some data that is as accurate as it can be, probably outreach to the various service agencies that are currently addressing this issue, that have clientele that are contacting them. Another CBP certainly would be another one, through their neighborhood centers. What type of responses are what type of need are they dealing with at that level? Does that answer your question?
Yes, and it does, Jason. And I assume that likewise with business, we would we would ask Chamber of Commerce and IDA to give us their assessment of need as well.
That would be my recommendation for those those sectors, definitely the business sector, the Chamber of Commerce and IDA. Yes.
What would it take to do that, Jason?
It take staffing resources, certainly, individuals that they could reach out to those agencies. It may be a question of, I mentioned telephone. It could be, email contact to lay out sort of the specific questions I would start, I guess, with county department heads. And then they could provide the information that they had, and then we could look to the other agencies that exist throughout the community to get that information.
Mr. Forsyth.
Thank you, Chair. Jason, I realize the intent of the tandem busing.
Yes.
But based on the low ridership, what is the actual utilization of that second bus? It's got to be.
It's low. Yeah, I can't. There are some in some routes we're seeing a high of about 20 riders a day. The issue is, and this is where we're a little bit at the mercy of this procedure, is that if we have 7 people at one stop and we can't pick them all up with one bus, then they may have to wait for up to 2 hours for the next bus. So that's the rationale for the 2-bus system. But we can certainly review that data and just see, how often is it being used, and is there a way to curtail that if it's not being used.
Mr. Burke, did you have another question?
Well, I guess I was just going to ask another question of Jason, that in order, assuming that we wanted to, as a group, as a legislature, wanted to respond in some way to reach out, I guess I'm wondering, is it worthwhile to try to take the pulse of the community? And we've done public health has done a wonderful job with the most pressing issue, and that's the COVID virus itself. But as we look to the fallout from that virus, certainly there's casualties beyond the illness itself. And I guess I wonder, Jason his background is planning, and he does a great job with that. In order to come up with some sort of an action plan, is it worthwhile to try to compile this base of data?
I think the data drives everything that we do, not only in planning. I think in we can just look to the COVID response for the value and importance of data, and the milestones that have to be met are all data driven before we can reopen. So I certainly the fundamental, I guess the core question is this valuable? I think understanding what the current status is valuable, certainly. At this point, that's what you would get. You would get sort of a marker right now. I mean, we're certainly not at the end of this pandemic or the end of the response to this pandemic. We're just beginning the response. So I think that identifying data at various milestones is important. So this would sort of be the kickoff assessment, I guess, if you will. of what's out there, of what the need is. Need change on a rapid basis. So the need that's there right now will be different next week. Is it possible to do this assessment every week? Probably not. But is it possible to do it monthly? Resource, depending on the resources that can be allotted to it, then certainly, yeah, that could be done. I think, I guess to get back to your initial question, yes, I think that data is always valuable. What that data can inform is more important, though. When you have the raw data, what you do with it is certainly what is most critical.
Thanks, Jason.
You're welcome.
Mr. Reagan.
Thank you, Mr. Chair. I think that, the most pressing need in the county is to focus like a laser beam all of our attention on getting the county reopened and businesses, as many businesses as possible reopened and people back to work, and a discussion about gathering data about the state of the county should wait until we get through the governor's steps of reopening the county to see whether or not there's a need for such a thing. At the moment, I think all of our department heads are incredibly busy with the many things that they're doing, and this discussion should come after the reopening takes place. We get through phase 1, phase 2, phase 3, phase 4, and then because in 2 weeks things will be radically different than they are right now. In 2 weeks after that, things will be radically different than they are right now. As soon as you have any data, it's going to be out of date and of little use. Once we get the county reopened, then seeing how we stand, we can discuss the need for that.
Legislator Haggard.
I think you said Mrs. Haggard, right?
Yes, I did.
Thank you very much, Mr. Chairman. We don't know a timeline for sure. I mean, we have a broad idea of when the reopening will take place, and there's a lot of suffering that could go on between now and when we make phase 3. And what we have to realize, I think, too, is that the phases are not automatic. We have to meet benchmarks along the way to go to the next phase. And who knows what that would bring. We certainly don't know a whole lot about this virus. But given what I've heard this evening, even though we haven't seen radical upticks in the need for emergency assistance or problems with substance abuse, I think there's something brewing under the surface, and we don't know what we don't know, and waiting until we're reopened might be something that is insurmountable at that time. If we could take a pulse of where we stand along the way without having to get into a lot of analysis, pulling up the data, I don't know what the burden that it puts on our department heads. That would be a considerable concern. But at the same time, we have citizens that fall between the cracks of they've never had services before. They don't know how to reach out for them. And we as legislators have a responsibility to all the citizens, not just the businesses, not just the people that are already in the system, but that broad swath out there who we don't know what's happening to them right now. So I would certainly go along with what Mr. Burke is suggesting about getting a snapshot of, at least at this point, of what the needs are, because waiting until we're fully reopened might be actually bring detriment to us reopening. There's a lot of suffering out there that we don't know about yet, and we know anecdotally, but I don't think we have the data yet. Thank you.
Mr. Burke, you had another question or comment?
Yeah, I'll try to make this my last comment, but whatever action we take, if we followed Jim's suggestion of a single focus on getting the economy reopened, it's again, it's based upon certain assumptions that is what is the absolute best course of action for all the people in the county. And I don't think that there's any of us that disagree that we'd love to see the county reopened. The question is what casualties may be what casualties may occur in that process. So I guess my point is that no matter what we do, it's based upon assumptions. And if we continue to shoot from the hip, rather than compile some actionable information, I think we do an injustice to the planning process. And I think right now, I mean, this may be one time in all of our terms that we need to do it right as much as we possibly can. And I think again, if we watch any TV, we always look for the ones who seem to have a base of information to share with us. And I would strongly encourage that we follow that same guidance for ourselves, that we compile a base of information. That doesn't mean that we'll go in one direction versus another, but having good data is critical to making good decisions. And I don't think it should be a single focus, and I don't think we should wait weeks to do it.
Mr. Perkins.
Yes, I think we're getting off topic. We're on the transportation update. I'd like to
We're on the
stick with
COVID
that.
update.
COVID transportation, yes. Okay.
Mr. Lightfoot, you had a question?
Yeah, but I'll keep it to myself for the time being.
Okay. Are there any other comments? Jason, I guess, and I'm gonna make this just a general statement of my own. You know, I think gathering data is a very good thing. It helps us make decisions. But I think gathering data for the sake of gathering data is not a good thing. But so I guess, Jason, what I would like to ask of you, two things. First being, do you have the time and the resources to gather the data? And secondly, would the data be meaningful? And you don't have to answer that tonight.
If I could, I would like to give it a little bit of thought, maybe have a conversation with the county administrator just about the capacity of our office, and look, maybe build a little bit of a framework of what we would actually do or could do, and what the outcome would be from gathering that data. So we know a little bit more about what the results are, or what the utility of that data would be, if that makes sense. Because yeah, I said before, we're all data driven. Data is absolutely what we need, but we have to have the right data, and we have to know what we're going to use that data for. Having that data as an assessment of the general health of the population, that has value, absolutely. That's a valuable piece of information. But the critical point there is, or the critical use of that data is, okay, now that we know that there's X number of or this type of need in this area, how do we reallocate resources to benefit or to address that problem? And that's what I think needs a little more exploration in terms of how we do that. So I am more than happy to work on this type of activity. Staffing,
we meet tomorrow.
Okay, let's
on staffing.
All right, let's do that. County administrator said that obviously you're meeting tomorrow.
Correct.
I would leave it up to the two of you to discuss it, and say, if there's something, if there's some way that we can do it, and come up with something that's meaningful, I would await your recommendation.
Okay, very good.
Mr. Lightfoot.
Happy to do that.
Thank you.
The only thing that I would ask for is this, that if we are going to expend the time trying to develop data, I would want to know two things. What kind of data are you looking for that the state isn't already collecting? And number two, I would want to know specifically with the data that you would come up with, that you would bring to light, in what way would it be used? In other words, I don't want to see a bunch of figures that it's, oh yeah, that's great. Yep. Now what do we do with it? Unless you can provide those answers, I'm a no vote for looking at something that I think would be redundant in light of the state, doing a very similar thing. Maybe not exactly what we would like to see, but that I don't know. But I think if we're going to do that, we need to have some metric to compare it with, some way to justify doing it in the first place.
Okay, anything else? Okay, let's move along to the 2020 census update, Jason.
Mr. Denisha, if I could just add those two other quick items under transportation, they'll take just a few seconds. I just wanted to let everyone know that the Department of Transportation has authorized the new route in Messina that will, I think it has 7 stops running from Messina in and around onto Akwesasne and then back.
Yes.
To Messina. So that will be starting up, we're hoping in June. And second item is that you'll see a resolution next month at operations amending some transit contracts, and we want to give you a little bit more of an in-depth overview of the whole transit system and what the future holds for transit with regard to funding and reimbursement, that sort of thing. So we're looking to bring in certainly Frank Daldo, the mobility manager, to operations next month, and possibly Matilda Larson as well from planning staff, who has been working very closely with Frank. So we can talk about that certainly as we move forward, setting the agenda. But I just wanted to give you that update that is the plan to bring that resolution forward next.
Good, thank you.
So census, yes, we meet probably on average about every 3 weeks with the Census Complete Count Committee, which is chaired by Legislator Burke, and the Census Complete Count Committee has a good group of individuals that is really dedicated to getting the word out about the census, and we're using them to distribute various promotional materials, flyers, that sort of thing. We also are quite a ways into the census count now. It started officially in March and will end in August. It has been extended. The original deadline for census responses was the end of July. It's been extended 2 weeks into the month of August. That will help. We also have some numbers, some data response rates that I believe has been shared with you, and I'll just summarize those very quickly. An overview: New York State's response rate as of last Thursday, March 7th, was 52%. The county's average response rate was 48.1%, so we're about 4 percentage points behind the state. However, in our highest population areas, we've sort of broken this into 3 different groups. Our highest population towns, including the city of Ogdensburg, we're much higher with our response rate. We're even ahead of this national average. Some real shining towns. Town of Louisville, 62.2% response rate. That's really fantastic. The last census, the state's response rate was only 64%. So we're almost there already in Louisville, and we still have a couple months to get there. There are a number of other high response rates, and in the table that I shared with you, we have it from highest to lowest, broken out by town with regard to response rate. And we will continue to promote the census as best we can in the current circumstances. So happy to answer any questions on census.
Any questions for Jason on the census? Jason, apparently there aren't any questions, but I do have a comment. I know that the Office for the Aging, I believe that they started today, passing out information with each home delivered meal client, information on the census. That's a tough group to get, and I think the Office for the Aging, I'm sure that they're acting in conjunction with the planning department to make that happen. But that is going out there. Try to get that demographic.
Excellent. That's good to hear.
There being no other questions on the census, Jason, I thank you.
Thank you all very much. Have a good night. Thank you.
Okay, Matt Denner, are you here?
You didn't get rid of me yet, Larry.
Okay, next resolution is modifying the 2020 budget for the Office of Emergency Services for a computer-aided dispatch and records management technology systems program. Get someone to move that, Mr. Perkins and Mr. Arquette. Go ahead, Matt.
Thank you, everybody, and good evening. This is modifying the 2020 budget for the Office of Emergency Services computer-aided dispatch. This is our Spillman program. What this is modifying the budget, and we're signing a contract with them to extend the services to the Village of Canton, Village of Messina, City of Ogdensburg, and the Village of Potsdam. That way, all of the law enforcement agencies will all be on the same page. All data will be shared with any kind of information that has been uploaded into the system, and it'll be available to all the agencies. We'll also be able to dispatch them through this system right directly to the cars, and they'll get live updated information as it comes into the dispatchers right to the patrols out on scene.
Okay, questions for Matt on that resolution? No questions. All those in favor of the resolution?
Aye.
Aye. Aye.
Opposed? Carried. The next one is authorizing the chair to sign a one-year extension with New York State Division of Homeland Security and Emergency Services Office of Interoperable and Emergency Communications for fiscal year 17 statewide interoperable communications formula grant. Okay, someone to move that forward. Mr. Perkins and Mr. Lightfoot.
All right, guys.
Matt?
This one is authorizing the chair to sign an extension. This is our SIG grant that we got back in 2017. This money will be used towards our communication towers that are currently going up at this time right now in Waddington, Governor, and Hammond. Give you a little update on those. Today, as of 4 o'clock, we hit 280 feet in the tower in Governor. So that's up. Now they're going to start working on site work for down below the pad for the shelter and the generator and stuff like that. We're moving next to go to Hammond. We're working on a few things on the foundation. We'll put the foundation in there. As you know, we ran into a little bit of water issue earlier in the season, and we're working with the DC right now to make sure we can get in with the restrictions we have with the wild birds that are in the area. And Waddington tonight, they're talking at their meeting about the lease agreement that we have coming up with them, and hopefully I'll have something back from them by the end of tonight. But this authorizes the chair to sign an extension for that grant used for those towers.
Great. Any questions for Matt on this resolution? Matt, I've got to say you've made significant progress on the one in Governor. When I was by there a couple of days ago, it was I don't think it was more than 20 feet in the air.
Yeah, Friday, the crane was supposed to be arriving Wednesday. It ended up getting there late Thursday. They started setting structures Friday. The first 80 feet, there were 2 sections, 40 feet each. They had to what they call stick build. They had to go piece by piece because of the size and the weight. Once they got 80 feet up at the end of that day, today they started going the rest of the way. So they put 200 feet up today. Those structures were already pre-built, sitting on the ground. They just had to use the crane to pop them up, and then the 3 guys, 1 on each leg, just bolted them together as it went up. And as like I said, a little after 4 is when they set the last structure.
Great.
You can definitely see it from a distance away.
That's good. All those in favor of the resolution?
Aye.
Aye.
Opposed? Carried. The next one is a resolution authorizing the chair to sign a contract with Midstate Communications for the interoperable radio site developments in Governor, Hammond, and Waddington. Mr. Sheridan and Ms. Curran. Go ahead, Matt.
All right, guys, this one is, we put out an RFP for the site development and Midstate was the bidder that we selected for the project. What this does is this goes into agreement with them for the 3 sites. So we signed an agreement for the money allotted through those grants to finish the 3 site developments at those 3 sites.
Great. Any questions on that resolution? There being none, all those in favor?
Aye.
Opposed? Carried. And the last one, Matt, would be an update discussion on the COVID-19 PPE.
All right, guys, I don't remember really what day we're going into with this, but in the beginning, how it all worked out is they asked us for a burn rate. So we reached out to all our first responders, hospitals, healthcare facilities, nursing homes, what they would burn through for PPE. So we established that burn rate, what we'd have per week. We submitted it. And the theory on that is we would get close to that PPE every week. Well, we didn't get anywhere near that every week, but we did get some every 6 weeks or so. As it came in, what we did is we, Jonathan and Dylan produced a spreadsheet where we could punch in the data, and it did by priorities where it all went in percentages. So it helped us calculate fairly where the PPE went, which we did get out as it comes in. We can say that right now, the only thing we have left in a stockpile is some hand sanitizer. We just got 5 pallets in on Saturday. We are getting that out to everybody requested. We ended up getting the 5 because it was being requested by quite a few people. We did get today, like Ruth was talking about earlier, 3,240 test swabs that I went and met the state down by Long Lake, picked it up and brought it back and dropped that off to public health this afternoon. They did get some PPE, small amounts of N95s and some gowns to go along with those testings for the nursing homes initiative that come out. But like I said, as we're getting stuff in, we're trying to get it out as best we can.
Any comments or questions for Matt? Ms. Haggard?
Thank you, Mr. Chairman. Have first responders been tested?
Yes, ma'am. You mean tested as in for the COVID or fit tested
Yes,
for the N95s? In the beginning, we fit tested all of them for N95 masks. And recently the Initiative 4 that just came out with testing for first responders, it is available for all of them. We did put it out. We did tell them what facilities they can go to get it and what the area hospitals. It's totally of their choice. The ones that did elect in it did get it done. We do have a lot of our primary agencies that do a lot of the call volume have been tested, yes.
Okay, and I don't know, it seems sort of alarming to me that we don't have enough PPE for our first responders. Are you really concerned about that? I know that you're you can't get it, but are the first responders likely to say, I'm not going to respond if I can't be protected?
What we did is
pretty serious.
Everybody saw this coming and knew the shortage of PPE was going to be there. So what we did as a countywide, we kind of narrowed down the amount of response that we got. Like normal situations, a first responder unit would get on scene first and then transporting agency later. Well, if nothing was life-threatening, that first responder unit, you would stand on standby somewhere at a safe distance close by. The transporting agency would get on scene, they would evaluate, and then they would transport. Even those crews are limiting to 2 just because of the exposure. So we are saving quite a bit of PPE on that, and they're rationing what they have. We have not come into a situation where any of them have reached out to me and said we don't have any. There are hospitals and other neighboring counties. When they get low, we've been reaching out to each other. They reach out to us, we reach out to them, and we kind of swap some PPE out for the first responders back and forth. But as of right now, we have not had any agency that came to me and said we do not have any, we're in desperate need.
Okay, because I mean, from what I can gather as a non-medical professional, we don't know who has the virus. When these people respond to a situation, they can't look at somebody and say, you know, oh, they're COVID positive. They might not show any signs of it. Furthermore, I'm wondering why it's not mandatory for first responders to be tested. Why is it like a personal choice?
It's hard to tell somebody that you have to go get tested. It's, you know, you can't force them, just like a lot of the vaccines. You can't force anybody to get a vaccine, you know, but it's there available to all of them. But all of them that have chosen to be tested have reached out and been tested.
Okay, because if they're dealing with the public, I would think that might be a concern. If we're testing medical professionals, they're also in contact with the same people frequently. So it baffles me a little bit.
Well, they've been tested. Like I said, most of our transporting agencies, the ones that do the prime number of calls, have been tested. We set them up with the facilities and they've gone in and got tests done.
Okay. Thank you.
Yep.
Any further questions for Matt? There don't appear to be any, Matt, but I just want to congratulate you and your department and all the first responders throughout the county, doing a great job in a difficult time with certainly not the best of circumstances. So Thanks. Thank you to you and all your folks and all the first responders.
Thanks, Larry. It's really been a joint effort between everybody. Everybody in the county, St. Lawrence County is great. Every department works great to each other. We help each other out, and that's what it's all about. As you know, Larry, it's a brotherhood. But thank you.
Thanks, Matt. Okay, Tom or Jenny, are you with us?
Yes.
Okay, there's Jenny. Board of Elections, we have a resolution authorizing the chair to sign a contract with New York State for HAVA CARES Act grant for the Board of Elections. Is someone to move that forward, please? Ms. Arquette and Mr. Beck. Go ahead, Jenny.
Yep, this is a grant that has come out to pay for expenses related to COVID-19. It's $126,402. This will cover additional expenses, not to supplement what was already in our budget. It will pay for additional mailings. Now we are paying for the postage return on all ballots. So it would cover expenses such as those that have been changed and weren't covered in our budget before.
This will not cover all of our expenses.
It'll cover what we can pay for
Yes.
with money that we are getting.
I heard Tom's voice, but I didn't see his face.
You're lucky.
Okay, there he is. Any questions for Tom or Jenny on this?
People keep asking me how much on the street. They're asking how much we're going to spend on this. And really, nobody has any idea because the rules keep changing and the situations keep adjusting. So it's really hard to get a number, but the number seems to be going higher all the time.
Okay. There being no questions, all those in favor?
Aye.
Aye.
Opposed? Carried. Very good. Thank you, Tom. Thank you, Jenny. Next up is Sheriff Big Wharf. There he is. I thought you were among the missing.
Oh, I've been here all the time.
We have a resolution authorizing the chair to sign a fiscal year 19 Operation Stone Garden Program grant with the New York State Division of Homeland Security and modifying the 2020 budget for the sheriff's office. I get someone to move Mr. Lightfoot and Ms. Curran. Go ahead, Sheriff.
So this is our Stone Garden grant we've been doing for several years. This year's award is $340,000, which is our largest to date. With $140,000 of it going to our office for our operations. We are then the pass-through agency for our three local agencies, Augsburg, Norfolk, and Messina. Messina being our new partner this year that was added. We also have our state partners, the state police and park police and DEC that are also involved in this grant. The one thing we do this year different than last, because the amounts were getting better and better, is that we put in for what they call management and administrator cost. That's a certain percentage of the $340,000. My undersheriff and my fiscal officer put a lot of hours, and I mean many hours. I think Sean's got down 122 hours on this grant. Kelly Reed's got 212 hours that she puts into the grant. It's pretty extensive grant, a lot of reports and pass through things that they all have to do. So the percentage that we will be getting that will go back to the county coffers is $17,000 just for their management and administrative costs. So that's a nice bonus for back in our budget that we wouldn't have in the past. We're getting things through like mobile radios, terminals for our patrol vehicles, some LPRs, which are our license plate readers. These are all this equipment and our overtime. is all funded by the federal government. So it really puts boots on the ground for our overtime costs, and it supplements our equipment costs. So it's a pretty extensive grant, but it's something that sustains work. Any questions?
Anyone have any questions for the sheriff on this resolution? Mr. Perkins?
Yes, I'm just looking at the numbers. Somehow it's $2 off somewhere in there from the 340,000. Maybe there's some rounding that's not put there.
I knew that we needed it down to like the pennies, and then the treasurer said you can't have pennies in the resolution. So I don't know if something got snafu there. You'll have to ask the bean counters. I do know
that could account for it.
It may account for something in there, but I know when you do a federal grant, it has to be to the penny. And then there was to get this resolution, it had to be changed. So I'll take the $2 out of my pocket. Swear to God, after what we went through. Go ahead, Renee.
Well, I was just curious.
That's fine. No, great question. Go ahead, Renee. I know you want to say something here.
No, we did have to round up on them, and that's why it's $2. They can only charge what they're getting to the grant. So there'll be 60 cents left here, 30 cents left there, you know, but we can't do budget mods for pennies.
Yeah, so it's not that Brooks has got to give $2 back. He's going to get $2 back.
No, we're only going to get 340 total. That's it.
I know.
So, okay.
Thanks.
Thank you, Renee. Is there any other questions for the sheriff? Oh, Mr. Reagan.
Not so much a question as a comment. I just want to thank the sheriff and his people for their work in obtaining this funding and helping communities like Ogdensburg and others to root out and send the message that St. Lawrence County is not a place where drug dealers are welcome or will be tolerated. I think you guys are doing a terrific job. The raids that occurred this past weekend certainly illustrate the hard work of you and your people, and programs like this Operation Stone Garden certainly help provide the resources to make that happen. And it's a job well done. So thank you.
Thank you.
Ms. Arquette.
Not a comment, Mr. Chairman.
Nancy?
I just wanted to say, can you hear me?
Yes, go ahead.
Okay, sorry. Not a question, just I wanted to state, Mr. Chairman, that I will be recusing myself from this vote due to my employment.
I didn't,
I couldn't quite hear. I think
I think you're gonna have to go through that again, Nancy, because it was
broke up.
broken up.
Sorry, I just wanted to state that I will be recusing myself from this vote due to my affiliation with employment with the DEC.
Ah, okay. Thank you. Any other comments, questions for the sheriff on this resolution? There being none, all those in favor?
Aye.
Opposed? Carried. And Sheriff, on the heels of the successful operation in Ogdensburg and throughout the county, can you give us our jail update?
Sure. So presently we have 54 inmates in the facility, no positive COVID cases, no one suspected. We had Dr. Williams assisted with the subjects that were brought into our facility from New Jersey about testing them for COVID. All but 3 would be tested, 3 refused testing. I'm taking all precautions with all the new inmates, segregating them in a certain pod, taking precautions, testing, temperature, et cetera, every day. So thankfully we can keep it out of there. We have one new female that was from New Jersey, and she's in the female pod, but she's segregated in what we call the day area. So she's separated from the other female. We're still monitoring all staff, any inmates on a daily routine, whether they enter or they're in the facility. They're all checked, temperature and other questions are asked. Other precautions are being made. Our video arraignment of inmates has started. Some of the county court proceedings are occurring. We're trying to expand that further. But there are certain things, sentencing and other things that can't be done by video at this time. So the sentencing of inmates and a few other things are still on hold. But we're staying steady in the 50 area. And the good news is we're keeping the COVID problem out of the jail so far. So we're really crossing our fingers to keep it out of there and doing everything we can.
Good. Any questions for the sheriff? Mr. Perkins.
Yes, Sheriff, I'd like to thank you and congratulate you on the drug bust last week and getting these criminals off the street. That's huge. Takes a lot of work, and thank you for keeping these gangs out of here.
Yeah, I just want to note that our office obviously had a big part in it, but it was a lot of agencies and a lot of legwork and a lot of intel that all the departments in the county came together, and there's still some rest to be pending. And as I stated before, I'll state it again, it's not under my watch. It's not going to occur. So we'll keep fighting the fight for sure.
Mr. Forsyth.
Thank you, Sheriff. So was I correct? An incarcerated individual has the right to refuse testing.
That
That
is
could
correct.
jeopardize the whole.
That's
And what-
correct.
where does it
Then I have to
fall
take
under?
other, I'm sorry, go ahead.
What does it fall under, Brooks?
The constitutional rights of certain rights they have, even in the facility, unless we get a court order to show cause, which is very difficult to get. But what I do is there's other precautions we can take with the further segregation of those inmates. So hopefully within 14, 15 days, we'll know that they don't have it. But they do have rights to refuse certain tests, and this is one of them. I know it doesn't seem right for the safety of the COs and staff and other inmates, but they do have that right. So unless I get enough significant information where they have some symptoms, a court order might be appropriate, but they're not showing symptoms right now to warrant that judge's order.
Okay.
But we have looked
thank
into
you.
that.
All right, thank you.
Legislator Haggard.
Thank you, Mr. Chairman. Sheriff Bigwolf. At this point, do the corrections officers have enough PPE?
They do. Actually, we have a good stock. We've been making sure that because they could really well be in contact, the close quarters, obviously with inmates and COs is hard not to get by with meals and med calls and other things that have to be done in the facility. So right from the beginning, one of my first priorities was to obviously my road patrol was out in the public, but the COs were definitely in a closed, confined area, so they were the ones with the first PPEs, and we definitely kept an eye on that, and we just actually got some resupplies a few days ago. So right now we're in good shape with PPEs for the COs.
That's great. And are they eligible for testing? Should they request it?
Absolutely, yeah, and we're trying to get now together. Actually, we're going to another phase of testing. And my next goal is to get all the COs and all the road patrols, civil department tested as soon as we can get that started.
One last question.
Sure.
The lack of visitors is still ongoing. Is that correct? There's still a
It is,
moratorium.
Yeah, and that's it's obviously an issue with the inmates right now, but as the public outside the facility is got to deal with this COVID and sacrifice certain things. The visitation, if I start that, it could really cause some issues. I just had a discussion with several inmates actually on this the other day, and they understand that there's a crisis out here, and but they're getting frustrated like other people out in the public are. But I tell them you need to stay patient. Patience is safety, and obviously safety of the inmates and the COs and the staff in the facility is very important to me, and it should be to the public. So they have to stay patient. When we can get where it's a safe environment, I'll open it back up. But as I told them, I don't see that being done anytime soon.
Thank you very much, sir.
Sure.
Any other questions for the sheriff? Thank you, Sheriff.
Thank you.
It's not going far.
And yes, onto the
Vacancies?
vacancy review.
Okay, the summary for vacancy review committee this month is very short, but we'll keep the sheriff right on with us as his position is the only one that we reviewed. Just some quick statistics and a reminder that we look at these August to August. And the general average has been between 155 and 160. So being a couple months away from closing that year, we're right now at 108. So that is a significant difference over our last 4-year average, as it were. The percentage right now of immediate fills is 87.96%. We are at 4.6% held 30 days, and 3.7% held for 60 days. So that covers the majority of the positions we've been looking at. I will remind you that at finance, you will see that we're in your vacancy packet for April. You will see the highway reorganization positions to be considered as they were held to be reviewed at May's finance. And unless there's any questions, I'll have the sheriff present the position he's requesting.
Go ahead, Sheriff.
Okay, I've got an open corrections officer position full-time. As you all know, New York State Commission of Corrections mandates a certain level of staffing, which is 56. If the corrections officer full-time leaving, it'd be 55. So I'm looking to fill this position to get back to the mandated staffing.
Okay. Very good.
Okay.
Thank you.
Thank you, Sheriff.
Thank you.
Next on to the county administrator's report. You want to cover the resolution first?
Yep.
We have a resolution authorizing the chair to sign a memorandum of understanding and a contract with the Rural Law Center of New York for indigent appellate representation. Okay, someone to move that resolution? Ms. Arquette and Ms. Curran. Go ahead.
So just to give a couple minutes reminder of how our structure is set up under indigent defense, we have a public defender's office, a conflict defender's office, and then assigned counsel. And we carry out our contract with the Bar Association. However, inside of the assigned counsel, we have 3 groups. We have appeals, we have family court, and we have criminal court expenses. And that's how you'll be able to find that in your budget. And since 2014, the Rural Law Center has been providing appellate services for us. And for any of you who may know a little bit about appeals, they can be extremely long and drawn out and staff intensive. So this is a service that our 5-year average with the Rural Law Center and our expenses overall have been $228,185. So we went through a period of time, probably about 4 years ago, where the appeals dropped right off. And during that time, the Rural Law Center worked with us to reduce both the appeals they would cover for us, but also a reduction in the amount that they would charge us. So being in the North Country, it isn't very easy. We have probably about 3 or 4 other attorneys, individual attorneys, that perform very specific appeals like parole. But beyond that, the Rural Law Center is respected by the 3rd Department. And as you can see in the resolution, we did lapse in our agreement. So we would like, if there's no objection to continuing with the Rural Law Center, we do have $220,000 budgeted for this year. And we do have part of this cost in our funding from the state under the Indigent Legal Services which, like all other aspects of state funding, we're not sure of, but we're going to move forward because there are appeals waiting for their services. So I would like, if possible, to have you consider this contract.
Questions on the resolution for county administrator? There being none, all those in favor?
Aye.
Aye.
Opposed? Carried.
Thank you. And just a few other items, COVID related. I did want to mention that having Heather and Jason speak on what departments are doing during this time, I think while you're receiving lots of questions, different kinds of concerns, arms you with information about how we're working during this time. And certainly with the largest of our county staff in social services, they seem to have improved their work life. And so I think following the response to COVID, we would be wise to look at some lessons we could learn and improvement to the work life of our staff. And I think that you saw that in Heather's presentation about how much better in some circumstances, and certainly in other respects, how quickly they're able to respond. We've placed vehicles in the communities as the board took action years ago, not to have employees other than those approved, to have vehicles at their homes. These vehicles are located at municipal locations around the county that they can go and pick up in order that they respond. And they have also agreed, some of them, to further the population densities in the office, come in over the weekend to bring back work, pick up other work. So they've been very receptive to doing what's necessary to, one, preserve their own safety, but also to be respectful of the requirements that we have with the 50%. So anyhow, the reopening efforts, as you've heard from a number of folks this evening, are gaining momentum. And I won't belabor the 7 criteria, but I will say that 3 areas were identified today: the Finger Lakes, the Southern Tier, and the Mohawk Valley, which does include Herkimer County, one of our neighbors. Will have met the criteria and will begin the reopening process. The North Country and Central New York have reached 6 of the 7 criteria. And as we've also talked at great length about, the testing component is well in hand, I believe, for most all of the counties where this is. The only challenge I think we will find is the lab processing of these tests. It's great to have them in hand, and it's great to look at different demographics we can get tested, but it's the turnaround on the results that will also be important once we're doing the testing. Out of the 602 tests we reported to you last week, 215 of those were damaged, and they were 4 days from expiring. The ones that Matt reported to you tonight that we received, over 3,000, they are 3 weeks from expiration. So certainly an improvement, I think, on what we're receiving as far as test kits, as well as they were accompanied by some PPE. So I think there's a real concerted effort to get testing where it needs to be to meet that 7th criteria. I did just want to update you on our activities of late last week. Chairman Lightfoot, Dr. McGuire, and I met last Thursday with 4 of the Amish bishops, and we were able to allow Dr. McGuire to talk with them about the concerns. We learned, I think, in some confusion in the public's perspective, that they have not held church services in over 3 weeks, and we're very interested in the process by which they could safely resume their services. So we talked with them about the importance of social distancing, about masks. I will indicate that they all wore masks for the duration of our discussion, and they accepted over 350 masks that I took along just in case. So we had a good discussion with them. They certainly want to be in compliance, and we were able not only to discuss the fact that when they come into town or places where they might encounter folks that are not Amish, that they also should be proactive about preventing the spread in their own community. So it was a very good discussion, and Dr. McGuire also indicated that going forward, not only in a crisis, but the importance of open lines of communication like this would be something we'd be interested in. So it was a very nice discussion. On Friday, we were able to talk with Senator Ritchie about testing with Dr. McGuire and Dr. Williams and explain the process of which I just described. Once the testing kits are received, how are we supposed to proceed when everyone is pushing tests through the process? We really need to make sure that it can handle the volume. So she was very receptive to try and assist. On Saturday, Chairman Lightfoot was convened for the first of the control room discussions. And if you recall in the criteria described and outlined by the governor, that's one of the important thresholds for reopening. It included many county administrator, county manager types, but also the chairman to lead the discussion. This is led by Commissioner of Parks, Eric Kulisek, the governor's staff, you may recall, on the Ready Commission, Molly Riley, as well as our DOL regional rep, Seth Bell. So that's going to be a daily discussion throughout this process, both when we meet and following our meeting of the criteria to reopen. They seem very interested, and it's a small discussion which hopefully will bear fruit in getting those criteria met to proceed with reopening. I shared with you today the dashboard for that reopening. Many of you may have seen it, but it's a direct link to the governor's website that will track as the counties around us and regions meet those criteria. And it also demonstrates how far away we are from that measure as well. Next week at Finance, May 18th, we will hold that meeting via Zoom. And I think at this time, we do consider the expiration of May 15th being a trigger also for our state of emergency. However, we should consider that there has been an extension of 202.4, which was renewed in 14 and then in 18, that would require us to continue meeting by Zoom. So at Finance, I think we'll be better prepared to discuss if you'd like to hold any additional meetings in June via Zoom. And if that's the case, we would like to discuss how we might best allow for public comment. So we first held, in a bit of a rush, the April board meeting via Zoom and weren't able to accept public comment. And we just held our May board meeting, which those are the two meetings that we invite the public in to share their opinions and their concerns. So what we'd like to do is consider accepting both written comment as well as short video that we might share with you. But we're going to look at a few other options to figure out how if we choose to continue holding meetings via Zoom until such time as we can resume meeting in this chamber, how we might best allow the public into the meeting to provide comment. We've certainly seen and read about many challenges that other municipalities deal with associated with both allowing many into the forum as well as even with invitations. So we're trying to protect the safety and integrity of the meeting, but also we'd like to provide you with options for public comment. I did want to mention to you that we'd like to have, as the May meeting typically provides, the treasurer will be presenting the 2019 unaudited results. And prior to that meeting, we'd like to schedule a fiscal stability and audit committee for 4:30 via Zoom to review those results with Drescher and Malecki. They'll be back, as you'll remember, either in August or September to provide the official results once they close the audit. We'd also like to bring the Chamber of Commerce. There was a question last week about how they would be spending the additional $42,000. So we'd like to bring them in to provide you with that, as well as an update on their activities and hopefully the plans for Bass. So as you've seen also some of the updates and some of the reschedules, we'd like to hear where they're at and what that budget may be looking like. I did want to mention to you that the social services monthly statistics have been loaded for Google Drive for you. And then also, as a part of the overall national shutdown, 17 of the 21 vehicles that we've ordered through the Enterprise Fleet Program for this year will be delayed. It is expected that Ford will resume production May 18th, and we'll be advised shortly thereafter when they will arrive. We have received 4 of the vehicles, and they've been changed out for the vehicles that they are replacing. One of the things that happened in the 2020-21 New York State budget was a change in funding associated with court commitments. And to that end, the county has been responsible for 50% of the costs associated with court commitments. So we were fortunate, looking back over this, in 2017 and 18, we didn't have any. But the way the budget reads now, the county's gone from being 50% responsible to 100% responsible. And so in looking at the numbers, we spent, since 2016, $255,804. So you can double that to $511,608 going forward. And in 2019, and now still in 2020, we do have at least 2, but up to 3 people who are currently committed and we're paying bills on. Those bills will shift, I would imagine, beginning in April. We'll see those bills probably in the next 20 to 30 days. So I did want you to be aware of that. I think that's all I have unless there's questions.
Questions for County Administrator on anything that she has covered? Good to go, Ruth.
Thank you.
Do we have need for executive session?
We do, in all categories after the committee reports.
Okay, thank you. I got ahead of myself. Committee reports. Ag and Farmland Protection Board. Myself have nothing to report other than regards to the first resolution that we had this evening, adding 6 parcels to the agricultural district. That's something that came directly from the Ag and Farmland Protection Board. Next one would be alternatives to incarceration board, Mr. Burke.
There's nothing to report. There have been no meetings.
Okay, thank you.
I don't believe it.
Okay, we'll skip that one because I think the Board of Trustees for Supreme Court Library, that's something that will have to be a chair's appointment. Emergency Medical Services Advisory Board, Ms. Curran.
Our next meeting is May 26th at 7 PM.
Okay, thank you. Environmental Management Council, Ms. Terminelli.
We have not had a meeting.
Okay, thank you. Fire Advisory Board, our next meeting is Thursday, June 19th. I think the only thing I do want to report is that although we have not been able to have actual training at the training facility, there's been quite a few sessions that have been conducted electronically that folks could take advantage of. Intercounty Legislative Committee, Ms. Arquette.
Yes, I have nothing to report. All meetings are on hold at this time.
Thank you. Jury Board, Mr. Sheridan.
The jury board has not met recently, Mr. Chairman.
Okay, thank you. And Planning Board, Mr. Fay. Can't hear you, Dan. Dan, I can't hear you. I think you're on mute.
Okay now?
That's better. I can hear you now.
I'll go back and I said, most of the items that the planning board had dealt with this past month were presented by Jason as part of the agenda tonight. I'd like to point out our next meeting is Thursday. And we will be reviewing a proposal for a new convenience center in the hamlet of Morley in the town of Canton at the corner of County Route 14 and County Route 27. So I guess that's a little bit of good news for talking about at least the new business at this point in time, hopefully. Okay, and I guess that's all I got to report. Thank you.
Okay, thank you, Dan. Do we have any old business to come before the committee? Do we have any new business to come before the committee? We do have the need for executive session for the purpose of negotiations, litigation, personnel, and appointments. Get someone to make a motion that we move into executive session. Mr. Perkins and Mr. Fay and Mr. Lightfoot, all those in favor?
Aye.
Aye.